Heat injury from the Ministry of Health Pocket Manual in Emergency, Saudi Arabia Ministry of Health. The most serious type of heat-related illness is heat stroke. The most serious type of heat-related illness is heat stroke. Heat stroke definition includes a core body temperature more than 105 Fahrenheit or 40.5. The central nervous system dysfunction, exposure to heat stress, endogenous or exogenous, exclusion to include CNS infection, sepsis, neuroleptic malignant syndrome or malignant hyperthermia, secondary to aesthetic agents. Aesthetic agent. So, heat stroke definition includes the core body temperature is more than 40.5, core body temperature more than 40.5, central nervous system dysfunction, central nervous system dysfunction, exposure to heat stress, endogenous or exogenous, exclusion to include CNS infection, sepsis, neuroleptic malignant syndrome or malignant hyperthermia secondary to an anesthetic anesthetic agent anesthetic anesthetic agent CNS due to anesthetic agent. So the risk factors for development of heat stroke by type: classical, both, and exertional type. The classic, both, the exertional type. The classic risk factor for development of heat stroke: elderly, children, social isolation, confined to bed, debilitated, lack of air condition, live on top floor of building, heat waves, chronic mental illnesses, cardiopulmonary disease, and chronic illnesses. The both drugs, obesity, current febrile illnesses, barrier dehydrating illnesses, skin disease, metabolic condition increasing the heat production as thyrotoxicosis, lack of acclimatization, barrier heat stroke, previous day's heat exposure, elevated heat index. The exertional, protective clothing, recent alcohol consumption, lack of sleep, food or water, lack of physical fitness, later skin pigmentation, motivation to push on self-warrior mentality, reluctance to report problems or lack of coach or athlete education regarding heat illnesses. Clinical presentation, history, information must be sought from the emergency partner, personnel, witnesses and family members, medication, preceding events in order to understand the circumstances of heat injury as medical illnesses or exertional activity. The physical examination, ABCs, and reviewing the initial vital signs, tachycardia, hypotension, tachypnea and tachycardia, mental status, hydration status. Differential diagnosis, delirium tremens, EKA, encephalopathy, hepatic, encephalopathy, uremic, hyperthyroidism, meningitis, neuroleptic malignant syndrome, tetanus, toxicity, cocaine, toxicity, phenylcyclidine, toxicity by salicylate, the workup, complete blood count, serum chemistry, chest radiography, CT of the head, ECG, echocardiography. The diagnosis of heat stroke: a core body temperature generally more than 40.5, central nervous system dysfunction, exposure to heat stress, endogenous or exogenous, exclusion to include CNS infection, sepsis, neuroleptic malignant syndrome, or malignant hyperthermia secondary to anesthetic agent. Some sources include a marked elevation of hepatic transaminase, however, this is not universal. The management: pre-hospital, patient should be placed in a shaded area. Tepid water may be applied to the patient in order to initiate the evaporation process. Manual fanning: patient should be removed from any external heat source if applicable. Emergency partner transport should be initiated with appropriate level of transport capability. Gradual rehydration with exertional heat stroke. Clothing removal, external cooling through fanning or air conditioning, and continuing monitoring are all appropriate pre-hospital measures that can be undertaken. In hospital, for heat stroke, rapidly removing clothes, pouring tepid water over the body, directing a fan on the patient, ice pack in both axilla and groin, not used alone but as combination with evacuating cooling, aggressive cooling with goal less than 38.3 in 30 to 60 minutes. If goal is reached, starting diagnostic study. If goal is not reached, consider invasive cooling methods: gastric, pleural, and bladder lavage, intravascular cooling device, extra corporeal percutaneous disposition. Admit all heat stroke victims to ICU. Thank you.